have with us on the Talk Back today Dr. Mila Brujic, and we have a very important topic to talk about, something people may not be aware of. It's called Infancy Week. Infancy Week. We'll explain that here coming up in a little bit. You have a big kickoff coming up for it on Saturday at the Imagination Station. Give people an idea what this program is about and the kickoff itself.
So Infancy is essentially this program that was created to really allow children from 6 months to a year of age to get a comprehensive ocular assessment at no cost. Wow. And we're really kicking off Infancy Week, which is a week that was built to build awareness about the program at Imagination Station this Saturday from 11 to 3 p.m.
Okay, so do you feel like that not enough parents think about vision for a child that young?
Yeah. One of the things that we find just in general is that there's this perception that it's very difficult to test a child's eyes because most adults associate an eye exam with which one's better, 1, 2, 3, or 4.
Read the letters in the chart.
Exactly. Right. When most of the information that we actually get from these exams is objective information, and we can utilize those tools to really get a good assessment of how a child's eyes are focusing. So essentially really how well or how poorly they're seeing, but in addition to that we can assess the ocular health as well too.
Okay, in your experience, is there a certain time frame where you notice that there is something seriously, maybe not a serious problem, maybe it's a small problem, maybe it is something more serious. Is there a time frame that young when you really see that there could be an issue?
Yeah, well, we know that 1 in 10 children will have some type of issues, Sean, something that they need to be monitored for. So really the key here is to get them in between, again, that 6 to 12 month time period so that they can be detected, that they can be identified, and really so that we can help them so that vision isn't something that may be limiting future success of the kids in school and things like that.
And that's a great point because it's amazing how, you know, the little things you can do now to help your child will help them in the future. Yeah. So where did Infancy Week come from?
Well, Infancy Week is really the week that was put together to really raise awareness about the program. But Infancy started in 2005. And really one of the largest challenges we have is educating people on it. So we thank FOX for really allowing us to be on here and just really raise awareness in the community.
Okay, so next week, are you having different events? Do you just want to make sure that parents get in there and try to find one that works out for their budget?
Yeah, absolutely. So next week, essentially what we're doing is this is the first time that we've devoted a week as Infancy Week. And again, this is really kind of a pilot program at this point because this is really the first time we're doing it, but we really are looking forward to being at Imagination Station this Saturday and really kicking off the week and really raising awareness for people in the community.
So are there low-cost programs? Are there free programs out there for people that can't afford them?
Yeah, so Infancy is actually a no-cost assessment for patients. So regardless of the insurance you do or don't have, regardless of the financial means that you do or don't have to pay for an assessment, it doesn't matter. Okay. There's no issues there, so there's really no cost barriers. So you really find an Infancy provider, and you can do that by going on www.infantsee, spelled INFANTSEE.org, and typing in your zip code, and then after that, it'll give you a list of your providers in your area. And again, there's no cost barriers.
Good. Okay, so check out that website if you need those services, if you have a child, even if they've gone through one exam, maybe try to get this other one.
Absolutely.
All right, doctor, thank you very much for your time. We appreciate it, and that's your Talk Back.